This is Dr. Patricia Houston, Vice Dean Medical Education of Temerity Faculty of Medicine, reading Commitment to Collaboration.
Over the last 18 months, I've had many experiences from my dual vantage point as a hospital anesthesiologist and critical care physician and an academic leader. I've listened and learned, argued and advocated. I've helped move people and programs across the city and online to ensure academic and patient care continuity in the face of an incredible strain on our healthcare system. I've had difficult conversations and made tough decisions week over week. And I've cared for very sick COVID-19 patients and helped many residents learn to do the same with care, compassion, and courage. My colleagues and I know this is the most difficult work we may ever do in our lives, and the story isn't over yet. There's much left to examine of the toll of this pandemic and the scale of inequity it has revealed, and yet, supported by a loving family, my established career, and some of the best colleagues and friends a person could have, I know I am extremely fortunate. Today, I want to share some thoughts on how we can create a better future for education, research, and clinical care that learns on what we've learned, that builds on what we've learned through COVID-19. The pandemic forced healthcare teams to prioritize and reprioritize. We had to do, and what we couldn't do, based on best available information at one time. I would argue that these constraints led to a new level of interdependence and respect for our interprofessional colleagues. Physicians learned from nursing, respiratory therapists, physical therapists, and we valued them as we learned how to better, as a team, prone our sickest patients. Colleagues from the humanities and social scientists generated important insights from socioeconomic and geographic data. Ethicists stepped up to help us to weigh the ramifications of what we would do if we reached a point where access to critical care had to be triaged. I'm thankful we never put those protocols into effect. The consistent focus on the importance of team-based solution is good for physicians like me. I was trained at a time when the deference to senior physicians was sacrosanct, a practice we know has left not only individuals scarred, but also served to further entrench rigid and exclusionary norms. These are the systems being examined, dismantled, and rebuilt with the principles of equity and inclusivity embedded into everything we do in education, research, and clinical care. Our working groups across the Toronto Academic Health Science Network are redoubling efforts to integrate Indigenous education and anti-racism work and to develop shared principles and pathways for learners facing mistreatment. The last 18 months have only underscored the need to ensure our teaching faculty have access to the tools and resources that they need to support the learners, as well as supporting their own well-being. I'm seeing this collaborative goodwill at work at the highest level. Hospital CEOs have shown a willingness to come together to hammer out collective solutions, from harmonizing infection control protocols and PPE standards, streamlining education and vaccination policies. The level of cooperation and integration has been impressive, and there's more work ahead, particularly in the domains of research and technologies. For all the undeniable suffering this pandemic has wrought, I'm profoundly hopeful for the future. The work in team-based care, inclusive educational environments, and robust new technology platforms that will move us ahead in research will set the stage for generations of Temerity medicine, faculty, staff, and learners to come. The commitment to a respectful, productive, collaborative environment is our post-COVID advantage. Let us not squander it.